But what brought me here is I actually grew up in this neighborhood, so I have a history and a relationship with Children's Hospital as a consumer. So it seemed very natural for me to, once I became a therapist, to actually work for the hospital and in my way kind of give back to the community that I grew up in. I think this community has changed a lot. I think it's for the better. And honestly, I think a lot of it has to do with the contributions that Nationwide Children's Hospital has made in terms of infrastructure, in terms of programs that are offered and available to the community. And I'll give you an example. Today, I'm actually participating in a job fair that Children's Hospital is hosting, and they're targeting and wanting to recruit from zip codes that are near this hospital. So things like that really, I think, are great to see the hospital doing. I think for me, I feel like I'm an advocate for children and families in this community, and I think Children's Hospital is also. So I think one of the challenges that we face, all of us as clinicians here at Nationwide Children's Hospital, is it seems like we never have enough time and clinicians and therapists to provide the services that are needed. Services like for families who are dealing with suicide or self-harming behaviors or abuse or violence of some kind. It seems like we never have enough bodies and enough time and open slots on our calendars to be able to service all the families that are in need. I find the work that I do here at the hospital very rewarding. I think the impact it's had on me personally is really just kind of seeing my life and career and Children's Hospital's kind of career and life in the community come full circle. I remember needing stitches when I was a kid because I fell off the bike and I came to Children's Hospital to get stitches. And now I have a daughter next week who's turning 21, and we've been in and out of Children's Hospital, over the years as she has grown up. And then now to be able to actually work for the hospital that has provided services for me and my family in this community for years has been great. So for me personally, being a therapist at Nationwide Children's Hospital feels almost like an honor. So I take a lot of pride in the relationships that I build with children and families. I think it's an awesome responsibility, and I'm sure other therapists take it really seriously. Ultimately, I think the impact of what we do is great. I love to see or hear about children and families actually moving past behavioral health services and actually having healed and having, knowing that we have met their needs and they're able to go on and move on and live happy, healthy, productive lives. I think that's like the greatest part of what I do and what other therapists do at Nationwide Children's Hospital, is to actually know from beginning to end that the services we provide work. We just need more money to be able to continue to provide those services and provide them to more people.